Hi, I'm Dr. Bryan DiMarco, and I'm a dentist at Renew Dental. One of the common questions that we get in our practice is, what is a dental crown? And I'm here today to answer a few of those questions. So one of the main reasons that we recommend a dental crown over a filling is that a dental crown is like a little helmet that goes on over your teeth. So the benefit of that is that it helps to strengthen your tooth and keep it together so that it doesn't crack on you, and we end up in a situation where we have to remove it. Dental crowns are very similar for most teeth. One of the biggest differences, though, is the ones for the back we're generally using so that you can continue to chew on the teeth, whereas the ones in the front are usually done for aesthetic reasons. Once a root canal is done on the tooth, because it does severely weaken the tooth, we do need to do a crown on those teeth. We do that for posterior teeth, or the ones in the back, because they're the ones that you're mainly chewing on and more susceptible to breaking. So the procedure for getting a tooth crowned at our office is a little bit different than what you'd see with a traditional crown procedure. What we offer at our office is CEREC technology. So what that allows us to do is actually do your crown all in one day. What we'll do at your appointment is that I prepare the tooth so that it's ready for the crown. And then what we do is we take a 3D digital scan of the tooth. This allows me to make the crown in the proper proportions and fit perfectly to your tooth. And then we have an in-house mill that will actually cut it out of a porcelain block. And then we then cement it on your tooth so you can go home that day and not worry about a temporary that's going to fall off. One other question we get asked is if children need dental crowns. We do crowns on children. They are a little bit different. What we do is what's called a stainless steel crown. So that's a prefabricated crown that will go on over teeth if they have large cavities or if they have cavities that are into the nerves of their teeth. So the placement of a dental crown is very similar to any other filling. We'll give you some freezing so that the area is numb, and we try to avoid any pain that you have during that procedure. The procedure is a little bit longer than a filling, but you will be frozen during the entire time. After a dental crown, it is normal to have a bit of sensitivity in the tooth. That typically will go away after a couple of weeks. Sometimes as well, the gums may be a little bit tender for a few days, but we usually can easily manage that with some saltwater rinses or Advil or Tylenol. When looking at clinical studies, a dental crown typically will last for about 10 years. We certainly hope that it's going to last longer than that for you. And the main way that you can keep your dental crown healthy is by making sure you're doing good brushing and flossing around it and coming in regularly for cleanings. One of the main reasons that a dental crown will fail is because patients will start to get cavities that form around the crown, the area that meets the tooth, and that's when it needs to be replaced. So sometimes some of the things that can cause pain under a dental crown is if you had a previous deep filling or a previous deep cavity, what can happen is bacteria can get into the nerve of the tooth and start to cause an infection. Unfortunately, when we get into this situation, we do need to do a root canal on the tooth as well as a crown, but that in most cases will resolve the pain and allow you to chew pain-free. So usually once there's a cavity under the dental crown, it will require the replacement of that crown. There are some scenarios that the cavity is very small that we can fix it with a filling, but the preferred method is usually replacing the crown. So we typically recommend that patients get dental crowns as soon as possible. The reason being is that we're usually doing it to protect your tooth. So the longer that we leave it and have you chew on the tooth, the higher the chance that you're going to end up breaking it. One of the problems with a tooth that breaks uncontrolled is that it can end up in a scenario where we then need to do a root canal, or if it's broken underneath the gums, we end up having to pull it, which we obviously don't want to do. So I hope I've been able to answer some of your questions today. If you have any further questions or would like to schedule an appointment to discuss more, please feel free to give us a call at 204-259-3804.